My name is Amr Azim. I'm a reproductive endocrinologist at New York City IVF. Egg donation has enabled many couples, single men, single women, or male same-sex couple achieve a pregnancy and parent children, and they were not able to do that in the past. Women consider egg donation when they have low egg reserve and they were not successful with multiple fertility treatments in the past due to low response to stimulation and low quality of the eggs and the resulting embryos. It also can be considered to avoid a genetic problem. It has been associated with good family dynamics in general, as much as we can tell, and the majority of women, men, and couple involved in egg donations were very satisfied with the outcome. To practice a safe egg donation, you and your reproductive endocrinologist should discuss multiple elements related to selection of the donor and conducting the process in a safer manner. In general, your reproductive endocrinologist is responsible for your safety, the safety of the donor, and the safety of your coming newborn. So during selection, the donor is usually psychologically tested to make sure that she is responsible and she knows what she will be doing, what she is doing, and fully accountable to understand the responsibility that she is going through, and would follow instructions related to medications. She is also tested regarding multitude of infectious diseases, and these tests are repeated within a short period of time of retrieving the eggs to minimize the chance of any disease transmission through the eggs. The egg donor is also tested to at least the genetic disorders that are prevalent and that are present in her ethnicity, or it can be also tested. She can also be tested to a broad group of genetic problems of 100 or more genetic diseases, to minimize the chance of transmission of a genetic problem to your baby. In the same time, your uterus has to be ready to receive the embryos. So the inside of the uterus should have no abnormalities in terms of a polyp or a fibroid or any other irregularities inside the uterus that could be fixed usually fairly easily with a simple procedure. The lining of the uterus should also thicken in a normal way and should exhibit a favorable pattern. And that should also be tested before proceeding to egg donation. And your partner's sperm should be also of adequate quality to affect fertilization. During the process of egg donation, the ovaries of one woman are made as a mirror image to the uterus of another. So one will receive, the donor will receive stimulation to produce an optimal number of eggs, and in the same time, the parent mother will receive estrogen to get the lining to the desired thickness and pattern. And while the cycle for the donor is conducted, when your reproductive endocrinologist deemed that it is appropriate, the eggs are retrieved, and at the same time the maternal hormones are changed by administering adding progesterone that will make the lining ready for implantation. The eggs are harvested and then they are fertilized by partner sperm or a donor sperm. The embryos are cultured, and then the embryos, one or more of the embryos, are transferred back inside the uterus. The success of egg donation is extremely high because the donor is usually selected to have excellent ovarian reserve and is of young age. The most common model practiced in the United States is an anonymous model. where you do not meet your egg donor and you do not know her, and her confidentiality is protected, and yours too. But another model does exist, which is a known model, where you would meet the donor and you would talk to her and get to know her. And this model is not very prevalent, but available also in the United States. There is a third special model where you would actually be a relative of the donor, like one sister donating to her sister. In general, it has been very satisfying to families that will need to use it.